This is Partners in Practice, a weekly series dedicated to the evolving field of the advanced practice clinician. Here is your host, Nurse Practitioner, Mimi Secor.
The nurse practitioner profession is one of the fastest growing professions in the United States and worldwide. Currently, there are an estimated 150,000 nurse practitioners in the United States and 350 nurse practitioner programs, graduating approximately 6,500 nurse practitioners each year. You're listening to ReachMD XM160, the channel for medical professionals. Welcome. I'm nurse practitioner Mimi Secor, your host, and with me today is Allison Blood, student nurse practitioner at the Massachusetts College of Pharmacy in Worcester, Massachusetts, and we're discussing the educational process and experience of becoming a nurse practitioner. Hello, Allison. Welcome to ReachMD.
Hi, Mimi, and thanks for having me on your show.
I was wondering if you could just share with us, why did you decide to become a nurse practitioner?
Well, while I was in nursing school, I had the chance of working with some fantastic nurse practitioners who I really admired. I could see myself moving into their role after acquiring my RN at some point in the future. I really liked the flexibility and the variety the profession had to offer. And my intent was to practice as an RN for a few years and then go back to school for my master's and become a family nurse practitioner.
What was your background before becoming a nurse practitioner student?
My background before was right out of high school, I went to Colby Sawyer College in New London, New Hampshire to acquire my bachelor's in nursing along with a minor in business management. After graduation, I worked in home care nursing and now currently in pediatrics. I am an active on the nurse leadership board at the hospital I work at, and I found myself wanting to continue to learn and to educate myself. So I applied to a few NP schools, and here I am 2 years later, plugging away at the family nurse practitioner.
What do you like about being a student nurse practitioner?
The thing that I like most about being a student is the opportunities to learn and to do further research. The opportunity to take the advanced classes has been great. One of the most fascinating aspects of healthcare is that the learning never ends, even when you are out of school. Medicine is constantly evolving, and I think that is why I am so intrigued by it, which is why I thought it would be great to continue on in my education. So far, my clinical rotations have been a great asset to my training as a nurse practitioner. Working along the side of MDs and nurse practitioners in a variety of settings has been an eye-opening experience. I have been really lucky to have great preceptors who take me under their wing and allow me to watch, participate, and discuss options of care. And so far, it's been a great experience.
So where are you in the program right now, Allison? What courses are you taking, currently?
I just finished up the semester taking Human Diversity, Social, and Policy Issues and Family Health Nursing 1, which is Pediatrics and Women's Health. Starting in January, I will be taking Research and Statistical Analysis along with Family Health 2, which is Adult Health. Currently, I am in an immediate care setting, seeing pediatric through geriatrics, and previously I was in an OB and GYN setting working along the side of a doctor.
So you've had a lot of clinical experience already, Allison. That's fantastic.
Yes, it's been great. The opportunities have been excellent. The total for our class is 40 credits and 500 clinical hours in pediatric, women's health, adult, and geriatric health.
So what courses do you enjoy the most?
I love going to clinical, and I look forward to my up-and-coming rotations in the spring and summer. The classes paired with the clinical allows for learning out of the textbook, discussion in class, but also the hands-on experience in clinical is what I enjoy the most.
What's most challenging about being a student nurse practitioner?
The most difficult part of being a student is juggling work and school. I am in a part-time program which has its pros and cons. I go to class all day on Mondays, and I have 16 hours of clinical per week, and I also work an average of 32 hours per week as an RN. Although being in school and working is difficult, I think it allows for a realistic option for those who need to work and can't afford to go to school full-time. From start to finish, I will be able to complete this nurse practitioner program in about 2.5 years, although some do it full-time and others take 5 years or longer.
Can you share with us a particularly memorable clinical experience you've had or a patient situation that sort of stands out in your mind, Allison?
Yes, I have several memorable moments. I think my first moment was when I completed my first GYN exam. It was a very exciting time, and I had a lot of hesitation going into that rotation. But overall, I really enjoying that clinical. It's a great sense of satisfaction when you do a thorough history and physical exam, and the patient is very satisfied with what you've done, and you've taken the time to answer their questions. And especially when the patient compliments you on your skills and your demeanor and the way that you present yourself. On a daily basis, treating sore throats, fractures, or just giving home care advice for simple things can also be very rewarding. It's especially rewarding when patients and family members compliment you on how you are able to explain things and how you're able to, give options and providing care.
Sounds like you're right in the thick of things here as you're building your skills and your knowledge. What has surprised you the most about the educational process of becoming a nurse practitioner?
The most surprising part of the educational process has been the number of people I have encountered along the way, finding my clinicals and the nurse practitioners and the doctors I have worked with. I have found most of my clinical placements closer to my home, and that has been very convenient for me, so I don't have to travel so far. But I also find that they have all been very supportive of me in all my clinical settings.
That's good to hear. If you're just joining us, you're listening to Reach MD XM160, the channel for medical professionals. I'm nurse practitioner Mimi Secor, and I'm speaking today with Allison Blood, student nurse practitioner at the Massachusetts College of Pharmacy Nurse Practitioner Program in Worcester, Massachusetts. And we're discussing the educational experience and process of becoming a nurse practitioner. What type of nurse practitioner position will you be seeking when you graduate?
I hope to work in a setting where I can see pediatrics through geriatrics. As you mentioned, there's a variety of opportunity. I see my learning curve being very high as soon as I graduate for the next several years. There's so much to know and so much to learn. I don't want to limit myself while I'm young on specializing right away into just pediatrics or only geriatrics. I feel at this point my options are wide open, and the FNP track seems to fit my needs.
Do you have any idea, Allison, where you might want to practice geographically? Are you going to stay in-state or go out of state?
I live in a small town on the border of New Hampshire, so I see myself working in Massachusetts or in New Hampshire, or possibly both. I would like to see myself work in a family practice setting or urgent care setting where I can see pediatrics through geriatrics. And, like I said before, that's the beauty of being a FNP is there's so many endless options.
What do you hope to accomplish as a nurse practitioner in terms of your big dreams?
Well, to start, as a nurse practitioner, I hope I can provide high-quality, cost-effective care wherever I work. Quality of care is important in patient satisfaction. As nurse practitioners, I think we can make a huge impact on primary care throughout the country. I also feel it is important to give back and educate those coming into the profession, so I see myself teaching in undergraduate courses throughout my career. A long-term goal would be to own my own practice. There are some great nurse practitioners in Massachusetts and New Hampshire who have been great role models for me as a nurse practitioner student, and they have successful practices. So I think long-term, that would be a potential goal of mine.
What do you think is most unique about being a nurse practitioner, and what's most special about the care that nurse practitioners provide in our perspective on health care?
I think the most unique aspect of nurse practitioners is the diversity as a provider and the variety of settings nurse practitioners can work in. We also bring our nursing background along with us, which is different than the PA track or becoming an MD. I think that our bedside manners and just our background as nurses is very important as a nurse practitioner, and I think many people value that in the public. As nurse practitioners, I think most do a great job at explaining diagnoses, treatment options, plans for patients and families, and this is really important for nurse practitioners to continue to hold a high standard that we offer to the public.
What do you think about the new recommendations for the DNP entry of level education effective 2015? And do you think you'll go back and work on that degree at some point?
I'm not sure where I stand on this right now. I've been thinking a lot about it. I think it's a great option if you would like to continue to advance your degree in your education and research. I'm not sure currently at this time if it's the right choice for all nurse practitioners, especially those who have been practicing for years, if that doesn't match their goals and their needs. But I'm also thinking of writing my thesis on this topic so I can better educate myself on the pros and cons of this potential requirement in 2015. I have started collecting articles and will also interview current DNPs who have been practicing, and along with those who are currently enrolled in DNP programs and those who oppose the movement in 2015. So hopefully by next summer I will have a better understanding of where I stand on this.
What do you think are the biggest challenges in the healthcare today, and how are nurse practitioners uniquely qualified to address these huge challenges that face us, particularly in this country?
I see the lack of primary care providers in this country as a significant problem. The aging population and advances in treatment of acute and life-threatening conditions are increasing the demand of health services. Between 2006 and 2016, nearly 5.5 million healthcare workers will be needed to fill new jobs. Employment in health practitioner offices is expected to grow by about 24% from 2006 to 2016, or by about 850,000 new jobs. Most physicians stay in urban and suburban communities, leaving inner cities and rural areas underserved. Physicians also choose to work in specialty areas because salaries are higher than in primary care. So I see nurse practitioners being a key to this solution, to being able to fill these gaps in these areas. Nurse practitioners can provide a high-quality, cost-effective care, and I think this might be one of the better solutions that we will have in the future.
What do you think about the salaries for nurse practitioners? They've been going up recently, and that's good news, but I just wonder, particularly in primary care, what you think about those salaries.
I think that they start off at a reasonable level for new grads. I haven't been out there applying to jobs yet, so I'm not currently sure, where I stand on this. But I think as far as trying to fill this void in primary care, the NPs will provide a great option. We do get paid less than medical doctors, but we don't have the training in the years that they do. However, we do have a significant amount of clinical hours and rotations that allow us to be skilled and qualified to see and treat people in primary care. So I definitely think it's a great option.
Have you had the opportunity to work with electronic medical records, Allison, in your rotations?
I have. I think it's a great idea. I think it cuts down on paper waste. I think that it reduces errors. The biggest drawback that I see is current providers and healthcare staff who have been on paper charts over the years are finding it difficult to make the switch to EMR. Once a practice has completely switched over to EMR, I think they find it much easier. And I think in the future it will be great, as more and more providers go on EMR.
Do you have any closing comments you'd like to share, Allison?
I just want to thank you, Mimi, for having me on the show and giving this perspective of a student. You are a great role model to all of the nurse practitioner students in my class, and we've had the experience of you in our class, and it's been great, and I think that you're a great asset to the nurse practitioner profession, and I look forward to, starting my career.
Well, thank you, Allison Blood, for being on the program. It's been a great pleasure talking with you, and good luck in your career.
Thanks for having me on your show.
You've been listening to Partners in Practice on ReachMD XM160. You can download this program and any other program in our library at reachmd.com. You can also follow us on Facebook and Twitter. Thank you for listening.